Just want to scoot, yep. Well, good evening, folks. Good evening. I was told that Dave's in charge, and he assured me that all the appropriate people are in the room and no one would mind if we started a few minutes early, because it's a bit warm in here and it'll get warmer as time goes on. And I understand a few of you are planning on dining out in Kingston this evening, so I don't want to hold you up from that. I'm Denise Cumming, the Executive Director of the University Hospitals Kingston Foundation, and I am absolutely thrilled to welcome all of you here to our ophthalmology unit at Hotel Dieu, and to engage all of you in celebrating a wonderful gift that all of you have made happen. But before we get too far into it, I want to introduce my co-MC, Ian Wilson, who has served as the chair of the Together We Can campaign. So over to you, Ian.
I'll slide with that microphone.
Yes.
Thanks, Denise. I actually know so many of you from my many visits to your clubs to ask for money. And I was saying earlier, it's not so much asking for money, it's giving you the opportunity to support something that you've always supported. And so to see you all here this evening in the ophthalmology unit, and me with my cheaters on, and I've been here to have cataracts done, and so many others have. This room is like this every day. All day, just crowds of people having eye work done, and your donations have made a huge difference, so thank you very, very much. I want to give special recognition to the people who are here. Mary Ann Smith, first Vice District Governor from Newburgh and Camden, right over here, and Vic Smith, the past District Governor. Mary Ann and Vic were my guides around the region, and went with me to so many clubs, so thank you both very, very much. Bill Lewis, past District Governor, and was the governor in the year that the Lions Club International Foundation came up with the grant, so thank you, Bill. Earl Oliver, the current District Governor, now Earl, back. Thank you, Earl, for coming. And different members from the different clubs that are in attendance, so wave when we call your club's name. The Amersview Club. Hey, that's my old stomping grounds, you see. And the Bath Club, still the, yay! And the Brighton Lions Club. I think that's hugely impressive, thank you. And the Cherry Valley Lions Club, yay! And the Kingston Lakeshore West Lions Club. Hooray!
It's my stomping grounds.
And the Kingston Lions Club. A few more hands.
Oh,
a few more hands.
We should make them roar.
Yeah. Another big club, the Napanee Lions Club. Yay! Big turnout. The Newburgh Camden Lions Club. Yay! Woo. The Norwood Lioness Club. Yes, thank you. Thank you. The Norwood Lions Club. Yes, again. Pittsburgh Township Lions Club. Hey, thank you. Yay! And the Sharbot Lake Lions Club.
I know where they are.
I know. And the Sterling Lions Club.
Yay!
Yay! And the Verona Lions Club. Huge donations. Thank you very much. And are there others here that I didn't mention? Shout out your club's name.
Margaret Grove Valley.
Marmora.
Yes, of course.
Thank you. I mean, isn't that impressive? Give yourselves a round of applause. Thank you.
Ian and I have been to so many of your wonderful meetings. I'm feeling like we should engage in some of the ceremonial activities that you have at the start of a meeting, but I'm not familiar enough with them.
I think you should join the line.
I knew that was coming. Anyway, it's my privilege to introduce representatives of Hotel Dieu Hospital who are here with us this evening. To my left is Sherri McCullough, who is the board chair. We have with us also this evening Janine Schweitzer, Janine in the back there, who is a member of our executive leadership team. And she's the Chief of Quality, Risk Management, and Corporate Education. I can actually see Scott McInnes is back there as well. Scott has a lead role with the Human Resources Program. Mike McDonald, who's the Senior Director of Patient Care Services. And of course, Dr. Martin Tenhove, who serves as the Interim Head of the Ophthalmology Program, Dr. Tenhove. And we've got several other folks in the room from Hotel Dieu and the University Hospitals Kingston Foundation as well. I would also like to introduce my board chair, Richard Kizell, who serves as the foundation board chair, and my colleagues Nancy Druick, Sean Wong, oh, way at the back, there we go, and Julie White on the camera. Back to you, Ian.
Okay, I'm back to the history of all of this. Well, Governor Bill Lewis was approached by the UHKF staff, and that was Erie Perkin-Behan, who's not with us this evening, but to consider making the Together We Can campaign the District A3 project for 2009-2010. And he accepted the opportunity, and we thank you for that, Bill, to make a difference to our hospitals. I traveled with a number of different people from UHKF because, I mean, I went out, but I was supported hugely by the staff at UHKF, but almost always with Marianne and Lion Vic Smith, to all the different regional clubs, campaigning for support, and you know, you pulled it together. Our campaign was called Together We Can, and you proved that the Lions could come together on a big project, and you really did. And with the help of the International, you pushed your donation to, I think the final number was 196,000?
Yes.
Spectacular. Thank you.
In total, more than 36 clubs made gifts and raised funds through bake sales and parade participation. I'm pretty sure one of you has a classic car show that I wanted to get to at one point. And you also, as Ian mentioned, applied and received a generous grant from the Lions Club International Foundation that allowed us to purchase an optical coherence tomography unit. Ian's talked about your incredible $194,000 commitment, but I wanted to take a moment to talk to you about what it was like to be one of the folks from the foundation who visited your various meetings. And I want to share with you specifically a little experience I had when I went to a meeting of the governors and past governors up in Denby. There was a wonderful woman who I think was the spouse of one of your Lions, who was working in the kitchen, and she introduced me to her grandson and told me the story of how she had really committed her life to raising this wonderful boy who had some special needs, and the unbelievable efforts she went to assist him in managing his autism and some other health issues that he had. And her story was just one of dozens that I heard as I was out meeting with all of you fine folks. So though we're celebrating your incredible generosity to our patients and to the work of Hotel Dieu Hospital, I do just want to tell you that you really touched our lives by sharing your stories of all of the ways that you're committed to the people of your community, to your families, and to improving the quality of life for all of us.
I'm actually stealing from your own material. This is a quote from the A3, District A3 website from Ruth Frank's book, 3 Cheers for Volunteers. And I just want to read that to you. When people volunteer, they bring into being 32 significant blessings. The first goes to the recipient as the most obvious beneficiary. Secondly, as every volunteer knows, the giver receives a second blessing through the empowering feeling of doing good. But it's a third blessing that is the most magical of all, when the contribution of the giver meets the needs of the recipient. And that's where the most significant of all human requirements is created, the creation of community. I'd like to ask Sherri McCullough to come forward and give us a few words. Thank you.
Thank you very much. So good evening. I am so pleased to be here and to welcome you on behalf of the Board of Directors of Hotel Dieu Hospital, and I see Sister Russell here as well, and the Sisters of Hotel Dieu. The Lions motto, "We serve," is the touchstone for everything they do. And we know that it has long guided their dedicated support of our hospitals, which are vital to the health of our community. At Hotel Dieu, this motto has been expressed many times over in the form of generous support for our ophthalmology clinic. Most recently helping to purchase optical coherence tomography equipment that is helping to meet with the rising patient volumes that we experience every day here at Hotel Dieu. And Dr. Teno was here, but literally there are days when there are people standing all the way back out the end of the hallway. The volumes are so great here. So in recognition of the Lions, many contributions to the ophthalmology clinic, and of their leadership in supporting the redevelopment of our hospitals, I am extremely pleased to announce the naming of Ophthalmology Lane 3 as the Lions Club International Foundation Ophthalmology Lane, with acknowledgements to the Lions of District A3. We are delighted to offer you this tribute, which will be a constant and visible celebration of an organization renowned for its commitment to projects that help us to conserve vision. On behalf of Hotel Dieu, thank you for that commitment and for the many benefits that flow from it to our patients, our family, and our staff. And thank you for putting your motto of service into action in our hospitals, and for inspiring all those who serve the healthcare needs of our families, friends, and community. Thank you very much.
It's my pleasure now to invite to the podium two amongst many of my favorite Lions, and they are Marianne Smith, the first Vice District Governor from Newburgh-Camden, and Bill Lewis, who was the Governor in the year that the LCIF grant was received, to say a few words. Marianne and Bill.
Thank you, Sherri, for those kind words and for the naming of the Ophthalmology Lane 3 in recognition of the Lions Clubs International Foundation and the Lions of District A3. It is a great tribute to all who supported this project, and I know that the Lions are delighted that they were able to help in the purchase of the new equipment for the ophthalmology department. We serve, and we thank you for this recognition.
First off, I'd like to thank the Foundation for this honor, naming the lane on our behalf. I'd also like to thank Erie Perkins, who's not here today, and Ian for their help through the Foundation and that. And also a big thank you to all the Lions in A3 who supported this project and helped us to get to our goal. Marianne, thank you for taking on this challenge when I asked you if you'd like to chair this. I know you had second thoughts at the time, but I had none. I knew you could get it done for us. And once again, I would just like to thank the Foundation for the opportunity to serve our communities. Thank you.
I think it's time for Dr. Ten Hove to say a few words. He actually sees all this money put to good use.
Good evening and welcome to the Johnson 6 Eye Clinic here at the Hotel Dieu. I must say, seeing the waiting room this full is nothing new to us, but seeing it this full of people coming here with something to give rather than waiting to be treated for eye disease is really quite special. And when I see the representation across this part of the province, I'm really quite struck by the depth and breadth of your generous support, ongoing support of ophthalmology and eye care in particular at Hotel Dieu Hospital. Now, many of you are no strangers to supporting this department, and in my previous role as interim head, I had a similar event, although there weren't this many people, and we named another lane previously for equipment given, I think that was about 8 or 9 years ago. So it's wonderful to see you coming back to the plate time and time again and supporting this hospital in such a generous and selfless way. We really do appreciate it. Now, eye disease isn't growing, thankfully, in our world, in our part of the world anyway, but our needs are, and there are two reasons for that. One is that we are getting older. The age of the average lifespan is getting older, and our ability to treat and diagnose eye disease is getting much more refined. And this optical coherence tomography unit that you purchased allows us with very, very fine resolution to pick up disease at an early stage, and allows us to modify and guide our therapy for a disease that heretofore was not treatable. So that's a big, big step, and that all occurred in the last 5 to 10 years, and you should be very proud of that. To give you some idea of scope, Only 6 or 7 years ago, we were seeing 35,000 people coming through these doors per year, and now we're well over 70,000. So that's not small growth. As the people in the hospital can tell you, they always quake a little bit when they come up here and see the high volumes that we're trying to deal with. But diseases such as glaucoma and macular degeneration, thankfully, have seen cures and or at least treatments that help preserve vision that is so vitally important to all of us in our everyday life. So with those kind of numbers of growth, it's clear that we needed new clinical space, and that's the next thing on the block. Right in behind us here will be soon built another 5-lane extension of this entire lane, along with a new injection suite for the macular degeneration, as well as a diagnostic suite where your OCT will live. So that's coming, and it really can't come a moment too soon. Any of you who have been patients here can attest to the fact that sometimes there's standing room only, and sometimes after a long wait it's sitting room only, and people are sitting on floors. It gets so crowded in here. So to expand a little bit is absolutely vital. It's vital to our patients, and they'll be very thankful. It's also vital to our very superb eye care team. We've got excellent nurses and support staff and physicians and residents that all work on this team, and they need a space to properly deliver their eye care, their research, and their attentive care to the patients. So they're very excited about this new development too. But there's much work to be done. The rooms need to be built, they need to be equipped, and there's many opportunities to still help us along our path. And it's my hope that we're all here again celebrating the opening of that clinic in the not too distant future, and you'll be able to see it for yourselves. So until then, enjoy the evening. I'm happy that you're all coming through and getting a chance to see the eye clinic, and in particular Lane 3. So thank you all. And before I go, I should thank the foundation and the hospital people. This is primarily about you, but I do, as one of the foot soldiers in the clinic, I do appreciate all the many people that have been introduced to you, piecing together all of these things, and I don't take your role for granted. So thank you.
I would just like to acknowledge that in order for a program to climb from 35,000 visits to 70,000 visits, you have to have some pretty tremendous leadership in the clinical area. And Dr. Martin ten Hove and his former colleague, Dr. Sherri have certainly set the bar high for the quality of care and the quality of medical education that they offer. And that's one of the reasons that we're seeing such tremendous growth in our program here, together with the financial support that you provided. At this point, I'd like to invite our board chair of the foundation, Richard Kizell, to come forward and say a few words of thanks on behalf of the University Hospitals Kingston Foundation. Richard.
Thank you. Before I came here, I was a little bit hungry, and I grabbed a little Easter bunny that I bought from Lion Mike Shabinsky. I got piles of them in my office. He's a great salesman for Lions. I think he's in the Amherstview Club, is that correct? Yeah. Odessa? Okay, well, if anybody needs any bunnies, I've got them. And they are good. So I want to thank, on behalf of the foundation, I want to thank all of you for being here tonight and for supporting the ophthalmology program. It's a program that in Kingston is really growing, as you've heard. And it's so important to so many people, and it's so great that it's right here in Kingston to assist so many. So it's really great to have your support. With the Together We Can campaign, we successfully met our target to fund the community share of redevelopment in all 3 of our hospitals. We could not have done it without your support. You showed us that together we can, and through your district-wide fundraising, together you did. Today we had the opening of the Cancer Center, and as part of the Together We Can campaign, and it's just great that so many service clubs have come out in support. But I have to say, I've been to many of these presentations, and I don't think I've seen such enthusiastic support from so many of you from the region who came today to celebrate this. So it's great that not only did you raise the money, but you've made the effort tonight to come out and see where your dollars are going, and we always appreciate to be able to thank you personally. Now, your gifts have not only made an impact in the ophthalmology unit, they've also supported all 3 of our hospitals, helping in many different ways, including helping pay for advanced equipment and technologies that improve health outcomes and create a better patient care environment, supporting new initiatives in research, and funding leadership development and training, which builds capacities in our hospitals. We can't stress enough that the government doesn't fully fund equipment, education, and research. And it's through all the donors in the region, all the service clubs, all the foundations, individuals, that we're building a better healthcare system in Kingston. We always had great staff, but our buildings were a little tired and falling down. And as you've heard, programs like ophthalmology, which are growing, need more space and better space to make the environment better for both patients and staff. So UHKF is honored to have your partnership, your support, and commitment to the future of healthcare in southeastern Ontario, and we are so pleased with the hospital's decision to name the space after you. So I want to thank you for your support in the past, for your support now, and for the support in the future, because we have a lot more needs in the equipment, education, and research areas. So thank you very much.
I get to say, please hang around a little bit afterwards. We're going to try to do a photo. I don't know how we do a photo of this big crowd, but we're going to try to do that. And I think we have some refreshments tucked around the corner as well, just to stave off that hunger that even the candy bars don't always work. Just on a personal note, I need to thank you again so much. It was such a pleasure for me to go out and meet with so many of you, not only during your meals where I met with whoever was sitting close by and talking with, but sometimes in the parking lot when somebody would follow me out to tell me their personal story. Healthcare is personal. It's about ourselves, our family, our children, our parents, and your help makes a difference for an awful lot of people in southeastern Ontario. The fact that you've come from so many different clubs where there are hospitals closer that I know you are also supporting, but that you recognize the special needs of this hospital and these hospitals as the tertiary care, the higher level of care, that you know that when your local hospital, your community hospital refers you on, they refer you on to the hospitals in Kingston. We're your hospitals. We happen to have this Kingston name attached to us, but we are responsible for over 500,000 people in southeastern Ontario, and an awful lot of people come through these buildings, and we really appreciate your help. By my going out to so many of your clubs, I was able to say to so many others, look what the Lions are doing, and that did help. $1 million is a lot of money. I was saying earlier, it's 1,000 of your close friends giving $10,000. Is that right? No, it's 100 of your close friends. It's 100 of your close friends. Okay, do you have 100 close friends? So it's 100 close friends giving $10,000. Okay, but we can do that. But we're not going to stop asking you, or like we like to say, giving you the opportunity to focus some of your own fundraising on helping so many others as you have with this gift, and we know that you'll do in the future with other gifts. So thank you so very, very much. Please, whose direction are we following for the photos?
Julie has a
Julie.
plan.
Julie has a